TEVA's medical affairs team prepared this compilation of science-based facts related to COVID-19 vaccines and how they work with your body to fight disease. This information does not replace professional medical advice. You should speak with a healthcare professional before taking any vaccine. Were COVID-19 vaccines made too quickly, and is there any reason for concern? Researchers have been working on mRNA vaccines for 30 years, and current vaccine development builds on experience and technologies used for other vaccines. One of the attractive features of mRNA vaccines is the ability to develop and scale them more quickly than other types of vaccines. COVID-19 vaccine development is being fast-tracked globally. However, the same phases of development, animal testing, small initial phase 1 human studies, phase 2 human studies for safety assessment, and large phase 3 studies for efficacy were all conducted for every vaccine. Standards of quality, safety, and efficacy are embedded early in the process and are not compromised by fast-track development. Companies ramped up production even before they knew the vaccines would work, and that a large number of infected people during the pandemic made exposures more likely, thus accelerating the results of the efficacy trials. COVID-19 vaccine safety, eligibility, and what to expect. How is the COVID-19 vaccine used? Some COVID-19 vaccines are given as a single injection and some as 2 injections, usually into the deltoid shoulder muscle of the upper arm, 21 or 28 days apart. What are the most common adverse reactions? Pain and swelling at the injection site, tiredness, headache, chills, fever, swollen or tender lymph nodes, glands, under the arm, muscle and joint pain, nausea and vomiting. They affected more than 1 in 10 people. Other adverse reactions occur less frequently. COVID-19 vaccine safety profile is generally consistent among vaccines. Adverse reactions are usually mild or moderate in intensity and resolve within a few days after vaccination. The common adverse reactions are a good sign and signal that the recipient is generating a robust immune response. As with all vaccines, COVID-19 vaccines should be given under close supervision with appropriate medical treatment available. Since the vaccines are new, can we expect long-term health effects? It will take more time to learn about very rare or possible long-term effects. At least 8 weeks' worth of safety data was gathered in the clinical trials for all the authorized vaccines. It is unusual for vaccine adverse reactions to appear more than 8 weeks after vaccination. Are there any differences between genders, races, or ethnicities? The same efficacy was maintained, and there was no safety signals that differ across genders and racial and ethnic groups. Can children be vaccinated with COVID-19 vaccines? Currently, there is no data for children younger than 16 or 18, depending on the vaccine, but some clinical studies in children have already started and some are planned at a later stage. Can pregnant and lactating women be vaccinated with COVID-19 vaccines? There is no data on pregnant and lactating women as they were not included in clinical trials. Therefore, their vaccination should only be considered when the potential benefits outweigh any potential risks for the mother and fetus. The trade-offs should be evaluated on an individual basis in close consultation with a healthcare professional to evaluate each individual's specific set of risk factors. Clinical trials in pregnant women have now started and more are planned. Can people with a weakened immune system be vaccinated with COVID-19 vaccines? There are no particular safety concerns associated with administration of available vaccines in immunocompromised people.